Good afternoon, everyone. This is Dr. Astral Webb. I am the Project Director for North American Management's Public Housing Primary Care Program, and I want to welcome all of you to today's webinar. Thank you for joining in. We have a really exciting topic today, checking up on elder economic security, and we're really excited to have this presentation because we know that 1 in 3 older adults is considered to be economically insecure, and they're struggling to pay not only their food bills, their prescriptions, their healthcare costs, but all other necessities. So fortunately, we are learning that there are a number of key benefits and services that are available, especially for seniors who live in public housing, to help them become more financially stable. So today's webinar will allow us the opportunity to recognize what some of these benefits are and highlight some of the resources and tools that may be available to connect your seniors in public housing to the assistance that they need. And some of these, as our presenter will go through, include your benefits checkup, your Savvy Saving Seniors Financial Education tools, and some state health insurance assistance programs. During the webinar, you're going to learn some of these key benefit programs and learn about some of the resources. As HRSA-funded grantees, we think it's important for you to be prepared and to learn what these are so that you can better aid your patients. Our presenter for today's webinar is Brandy Bauer, and Brandy Bauer is the Communications Manager for Economic Security at the National Council on Aging. There, she's responsible for gathering promising practices from the field and managing publications and online communications related to benefits access, as well as elder economic security. She has over a decade of experience in communications related to improving access to services for vulnerable populations, including health, humanitarian aid, and human rights sectors. So without further ado, I would like to turn this over to our presenter, Ms. Brandy Bauer. Thank you so much for presenting today's topic. We know that our grantees are going to learn extremely great and valuable information for their seniors in public housing. Bauer?
Thank you, Astral and Kevin. It's a pleasure to be with you this afternoon. As Astral said, I'm from the National Council on Aging, and for those of you who may not be as familiar with NCOA, we're a national nonprofit service and advocacy organization. We're headquartered in Washington, D.C., but we work with community organizations and state agencies all over the country, and we really help them to help seniors find jobs, find benefits, improve their health, and live independently and remain active in their communities. So as Astral sort of went over a little bit earlier, we're going to be talking a little bit about just kind of the background of the intersection between health and economic security before I talk about some of the key benefits that are available to older adults on a fixed income. I know that some of you have very different backgrounds, and so I'm really trying to start with some basic foundational knowledge about elder economic security and benefits. So excuse me if I repeat things that some of you may already be familiar with, but my hope is that everyone will find something useful on this call today. And then we will sort of go into a little detail on some of the key resources for this population and what you can do to get involved and to help some of the clients that you see on a day-to-day basis to connect with these services. So starting off, we at NCOA talk a lot about disadvantaged older adults, but last year we actually sat down and sort of thought about what is a disadvantaged older adult. And to us, we can define older adults as those 60 years and older, which is approximately 56 million Americans as of the most recent census. And roughly half of these have incomes below 250% of the federal poverty level. We define that as sort of the threshold of economic security. And 250% of the poverty level, you may recall that in 2012, the poverty level for a single person is $11,170. So 250% is around $27,000. Now, that may sound like a decent amount of money, depending on where you live in this country, but we still consider that potentially economically insecure because when people don't have assets to fall back on, they tend to be one event away from sort of losing it all and going into debt, whether that is through a health crisis or through a foreclosure or some sort of other catastrophic incident. What we know about this population is that roughly 18.8 million of these older adults have at least one chronic condition. And of those, 14.5 million have more than two chronic conditions. You know, in 2009, NCOA did a survey about older adults with limited incomes and chronic conditions, and one of the things that we found was that about 38% of those with chronic conditions did not have the money to actually do things that would improve their health. So we're talking not just about people who do have these conditions, but really lacking the resources to be able to sort of improve their health and to remain living in their communities. You know, here this chart on this slide really kind of breaks it down some more. We also know from some of our research that those who fall in under this 250% of federal poverty threshold also tend to have multiple chronic conditions that appear earlier in their life. About 59% of people in the 60 to 64-year-old age cohort already experience at least one chronic condition. And the severity of those chronic conditions only increases as they age. And if you look at this chart, you'll see that those conditions that are most frequent in this population are also those that can have really significant financial implications in terms of a person needing ongoing prescriptions to manage them, or needing durable medical equipment, or even sometimes costly procedures like surgeries for arthritis or heart disease, and which is yet another reason why people with chronic conditions are economically vulnerable. You know, benefits are really a critical resource in the spectrum of financial assistance that are available to older adults, especially those who are aging and they're out of the workforce. Many seniors aren't going to be seeing a change in their income. They're going to get whatever they're going to get from Social Security or, collect from whatever savings they have. And so when those sources of incomes, like savings, are exhausted or limited, they're going to have to find other means that are available to pay for their basic necessities. And this is what benefits programs do. Now, this probably is no surprise to you. You know, what do low-income seniors need help paying for, and what benefits can help? Well, NCOA has identified a couple core programs that can help pay for these areas of health care, prescriptions, food, utilities, and basic necessities that are available to this population. And together, these core benefits really represent a huge financial and quality of life sort of gain for these vulnerable older adults and also younger adults with disabilities. The programs that I'm going to be talking about are often available to anybody who has Medicare. And so that not only includes everyone over the age of 65, but it also includes many adults between the ages of 18 and 64 who, because of a disability, are unable to work or have very significant limitations on work and therefore are able to draw from Medicare. Now, this is not to say, when I list these programs here, Medicaid, Medicare Savings Program, SNAP, these aren't the only benefits available for this population. We sort of identify this as the core set because they can help meet these needs, but there are many, many more benefits, and I'm going to talk a little bit about that as we go along. But first, I want to go into some of these programs in a little bit more detail so that you understand them better. The first one I want to talk about is the Part D Low-Income Subsidy, which is sometimes called LIS or Extra Help. This is a program that's administered by the Social Security Administration and Medicare, and it's the one benefit that seniors who are eligible are most likely to have, and I'll explain that in a little bit more detail as we go along. This is a program for people who have incomes below 150% of the poverty level, and it helps them to pay for their Part D, their drug plan costs, which includes like their premiums and also like co-payments and deductibles if they qualify. It also eliminates this so-called donut hole or coverage gap that some people fall into when they have significant prescription costs. For LIS, people should have Part D, but they don't have to automatically be enrolled in a plan. If they are qualified to receive this program, they will be automatically put into a drug plan when they get in it if they're not in one already. And unlike Medicare itself, where there's discrete enrollment periods, this is an opportunity, this program for people who qualify. They can apply at any time, and they can change their drug plans at any time. So they really have a significant window of time in order to sort of gain from this. And what they get out of it is, obviously, they get their premium for Part D, which for most people is about $99 this year. And if they also pay very, very significantly low co-payments on their drugs, ranging from $1 to $6 at maximum. So a significant benefit for those who qualify for under 150% of the poverty level. Another key program that we talk about a lot is the Medicare savings programs. Now, these are financed by Medicaid, and I emphasize that because even though it has the word Medicare in the title, because it's financed by Medicaid, states have an influence over how it's administered and the different eligibility requirements. So there's a sort of federal eligibility threshold for these programs, but states can actually be more generous by either lifting those eligibility levels or eliminating any what we call asset tests, which is a measurement of how many resources the senior has. These programs help to pay for the Medicare premiums, and also those with they help to pay for Medicare premiums and also some cost sharing for Medicare. And I think I misspoke earlier. The Medicare Part B premium is $99 a month. The Medicare Part D premium for LIS is actually lower. It's roughly like $35 a month, depending on your plan. The Medicare savings programs, you may hear of them along different acronyms. There's the QMBI, which is the Qualified Medicare Beneficiary Program, and that's for people with incomes below the poverty level, and that pays the most significant spectrum of benefits for premiums, deductibles, and co-payments. There's SLIMBI, which is the Specified Low-Income Medicare Beneficiary Program, and that only covers the Part B premium. It's generally for people who have incomes between 100 and 120% of the federal poverty level. And then finally, there's the QI program, which is the Qualifying Individual Program. Again, it only covers the Part B premium, and it's for people with slightly higher incomes, usually between 120 and 135% of the federal poverty level. Now, if a person qualifies and gets enrolled into one of these Medicare savings programs, they are automatically enrolled into LIS. So they automatically get that drug benefit, which is why so many people who qualify for LIS get it automatically. Now, another way people can get LIS is if they have Medicaid. And I'm sure for most of you who work in sort of health centers, you know a lot about Medicaid. I probably don't have to go into what Medicaid does. But important to remember is that about 9 million people across the U.S. have both Medicare and Medicaid. These people are sometimes called duals or dual eligibles. And the important thing to remember about these dual eligibles is that depending on the state that they live in, Medicaid can cover certain services that Medicare does not. So, for example, Medicare does not cover hearing aids, it does not cover vision or eyeglasses, it does not cover dental care. But depending on the state that you live in, if your Medicaid program covers those things, that would provide a kind of wraparound service for people on Medicare. Medicaid, for people who qualify for both Medicaid and Medicare, will also pay for some of those co-payments and deductibles that the Medicare beneficiary incurs. And again, anybody who is enrolled in Medicaid and Medicare will automatically get enrolled into that LIS prescription drug low-income subsidy. So moving along to food assistance, I want to talk a little bit about SNAP, which is commonly known by its old name, food stamps, and some states have different names for the program, but it's called SNAP at the federal level. At a national level, it's administered by the Food and Nutrition Service of the Department of Agriculture, but like Medicaid and the Medicare savings programs, it's actually administered on a local level, and therefore the eligibility requirements are states are allowed to choose to vary them because, like Medicaid, there's a certain threshold at the federal level that they have to meet, but they can be more generous if they want to, and many times states are more generous for this program. As a general rule, people over the age of 60 who have net income less than 100% of the poverty level will qualify for SNAP. But again, this is the very minimum threshold, and many, many states have much, much higher. I mean, some of them even have up to 300% of the federal poverty level. The surprising thing about SNAP, though, is that only about 35% of seniors who qualify actually receive it. It's a seriously underutilized and undersubscribed program by older adults for a couple of reasons. I think there's a sort of stigma that's carried on through the last few decades. There's also this misperception that seniors will only get a minimum benefit of either $10 or $16 a month, which is not true. The average benefit for a senior nationally is about $119 a month, so that's quite a bit of money. And SNAP, in some states, still has rather complex application procedures. In other states, there are simplified applications, especially for seniors. But in some areas, there are still rather lengthy applications. However, some states are also bundling applications. So you might apply for Medicaid and SNAP and another program at the same time. And I think probably most of you may be familiar with SNAPs in how it gets administered to a person. They get an electronic benefits transfer card. They can use it at any participating grocery store, on any sort of, pretty much any food product as long as it's not prepared foods. And the benefits, the calculation of the benefits are based on the household composition. So the more people in a household, the higher potential benefit would be. LIHEAP is the Low-Income Home Energy Assistance Program. And this is given in the form of a block grant to states and territories from the Administration for Children and Families. The grants are basically awarded either directly to a senior or to their energy company. And even though you may be working with seniors who live in public housing, people in public housing are still potentially eligible to reap the benefits of LIHEAP. So you kind of have to check with your state's guidelines in order to see what the qualifications are, but that's not necessarily something that excludes people in public housing. The monies can be used for tuning up and repairing and replacing heating units, or for actually paying the energy bills. But because it's a block grant, it's each state sort of expends the money as soon as it kind of comes in. And that means usually there's an open call for applications, often in winter, often in fall or winter. And once those funds are gone, they're gone. So we always encourage seniors, if they need help paying for their utility bills, that it's really best to apply very early in the season, especially because LIHEAP is one of the programs on the federal level that has been really significantly cut back in the last few years. And generally, to qualify, households must have incomes below 150% of the federal poverty level, though some states often do raise that limit if the median income is higher. Supplemental Security Income, SSI, this is administered by Social Security, and it is for persons with extremely low or no income. So people who may not have worked their entire life, perhaps like widows of somebody who works, who aren't able to draw down much in Social Security. It's also some sort of like legal immigrants can draw down supplemental security income if they don't have a work history and can't collect Social Security. The income limits do vary by area, so it's really good to contact your local Social Security office for more information. The average payment is roughly $500 a month, so it's not a significant amount of money, but it is meant to sort of to give people kind of a baseline amount of money to help pay their basic necessities. And as with Medicaid and Medicare savings programs, if somebody qualifies for SSI, they automatically get enrolled into that Medicare prescription drug low-income subsidy, that LIS program that I mentioned earlier. Now, as I said before, these are just the core benefits programs that we talk about at NCOA. There are a lot of other noteworthy programs out there, and especially for people who are just above that kind of threshold of poverty that we've talked about for some of these programs. Some programs are available for people who have more low to modest income, but maybe don't fall kind of right near that poverty level. And some of the noteworthy ones amongst these are state prescription assistance programs. 24 states currently have these SPAPs, as they're called, and they really provide wraparound coverage for prescription drugs. They're for people who have Medicare, but don't qualify for some of these other programs that could help them pay for their prescriptions. Some Drug manufacturers like Pfizer and AstraZeneca have rebate programs as well, so that depending on if you're taking their brand name drug, you can qualify to get either a significant rebate or even drugs at no cost, depending on your income. There are lots of other food assistance programs out there for seniors, the most prominent of which is the Senior Farmers Market Nutrition Program, which is kind of like SNAP. It gives people money to spend at their local farmers market or farm stand in order to get fresh produce. It's available in some areas but not in others, so it's very area dependent, but it's certainly worth looking into. There's also emergency food assistance programs for people who truly do not have sort of any money and any food to sort of last throughout the week. There are lots of other programs out there. There's a free and reduced cell phone service. There's a couple different companies that offer cell phones to older adults and a certain amount of minutes that come free with that cell phone if they qualify. There are a lot of tax rebates and relief programs, especially for older homeowners, that are worth looking into, and a lot of these actually are for people who have even up to sort of middle income, so you don't have to be sort of absolutely poor to qualify for those. Now, to kind of come back to what we were talking about before, why are these important? Well, if you look at this chart here, we've really kind of broken down what the average annual value of some of these core benefits programs is. You can see for like extra help, that's the drug subsidy, that's roughly $4,000. For some of the health care programs, it's a little over $1,000. Food assistance, the same. SSI, obviously, because that's for people with no income, that offers the most value. But if somebody were to qualify for all of these, this has a potential value of $12,000, which, you know, for somebody who is earning right there. So clearly significant benefits, both financially and to sort of help with the well-being of the person. Now, as you all work with people who live in subsidized housing and public housing, you might be quite interested in the statistics on this slide. We have a tool called BenefitsCheckUp here at NCOA, which I'm going to talk about in just a few minutes. But through this tool, we're able to collect some interesting demographic data about the users. And we looked at people who are over age 62 living in public housing to sort of understand kind of what their needs are. And I think the most interesting statistic on this slide is the one at the very end, which is the fact that when we looked at this population, we found out that 91% of these people are already enrolled in one benefit, but potentially eligible for another. So we can't necessarily trust that somebody who is receiving one benefit is going to know about another program or is going to get automatically enrolled in another program simply because they're on food stamps, for example. So having awareness and education about kind of the spectrum of benefits and how to connect people to them will really help to reduce these numbers of people who are missing out. So that brings me to some of the key economic security resources, which you're probably thinking, well, how do I connect people to this? Now that you've told me about these programs, what do we do next? Well, starting with NCOA is the NCOA houses the National Center for Benefits Outreach and Enrollment, and this is supported by the U.S. Administration on Aging and provides a lot of technical assistance as well as just individualized support to people who want to connect seniors to benefits. I give you our website address there. That's centerforbenefits.org, and really encourage you to explore the site. We have a lot more detailed information about these programs that I've talked about today, as well as a resource library and library of promising practices about these programs. And we also have a series of recorded webinars, which is a Benefits 101 series. If you want to learn specific information about any of the programs that I've talked about, we have that available to you. NCOA also administers a tool called BenefitsCheckUp. Now, this is a tool that's been in use for over a decade. It's a web-based screening tool. It contains about 2,000 public and private benefits programs. And the tool is aimed at adults aged 55 and older. So most of the benefits are really for that older demographic. But we encourage anyone in the family or friends of an older adult can help them to do a screening as long as they have enough information about the person's income and expenses. I'm going to just walk you through a sort of sample of what benefits checkup screening would look like and what you enter. It's available at BenefitsCheckUp.org. Everything is completely free and confidential, so you don't have to worry about it taking any of your personal information or mailing or selling you anything. So when you go on to Benefits Checkup, you can see on the front page that you have the opportunity to do a comprehensive screening or a very specific screening looking just at food assistance or prescription assistance. Now, the screenings will ask the user for the zip code, and that's to help to identify very local sources of information and even benefits at the local level that the person might be eligible to receive. For example, some communities have public transportation programs or sort of free meals at senior centers or anything where we know that there's something very local that will be offered up if the person is, determined that they're likely eligible to receive that. Then the person is asked a series of questions about their household situation. Do they live alone? Do they rent or own their home? What's their average sort of Social Security income or other income? And also, how much do they pay on prescriptions and utilities every month, as well as what specific prescriptions they have, because as I mentioned before, some of these drug manufacturers have rebate programs, and so if somebody is actually taking a specific drug where there's a rebate program associated with that manufacturer, that would come up as well. Now, even if somebody chooses to just do one of these short screenings for food, for example, we have a mechanism in Benefits Checkup that's called shadow screening. And the shadow screening basically says, even if you go in and you do a very shortened version of this tool, the system looks at other programs and says, I know you were just looking for food, but you are also potentially eligible to receive some of these other services, like help with your prescriptions and help with transportation. And we do that to really provide just what we call a person-centered approach, which is just, we know that if you have problems paying for food, you probably also have problems paying for some of your other health care and other expenses. So when a person does the information, and depending on which screening you do, it takes about 10 minutes for the short screening. It can take up to 30 minutes for the longer screening, just, to fill out the information on income and assets and that sort of thing. Then you will see a screen like this come up at the very end, which is the results list. Now, it'll tell all of the programs that the person is, likely eligible to apply for. And if there are applications where they can apply immediately online, you'll see a button on that screen where they can actually do it through the site. Now, as I said, it's completely confidential. We have, for example, an agreement through Social Security so that if they want to apply for the Extra Help Low-Income Subsidy, it goes through to the Social Security site. It's completely secure. They're not leaving their information on our screening site. And likewise, if somebody were to check on one of these programs, they'd get a plain language fact sheet explaining what the program is, with links on the side to local offices. If there's a local office where they can go in person and apply, it'll have that address. It'll have website links. It'll also have application forms in different languages, because some states have very diverse populations and may have an application form in 10 languages. And if we have that available, that's also available to download from the site once screening is completed. So in addition to Benefits Checkup, I also want to point out another tool for people who may not be as comfortable using the web, because we recognize that there are a lot of older adults out there who just aren't web savvy or may not feel comfortable. And that's the Elder Care Locator. This is a program that is administered by the National Association of Area Agencies on Aging, which is called N4A. And they have a toll-free phone number, which you see on the screen there, that allows people to call in and to basically to state their need, to say, I'm looking for food assistance. And the elder care locator staff will make what's called a warm transfer to a community agency, which means they will get somebody from a community agency on the phone, sort of introduce that person to the caller, and sort of let them connect that way. Earlier this last month, NCOA and N4A launched a campaign for consumers called You Gave, Now Save. And we really wanted to promote these two tools, BenefitsCheckUp and the Elder Care Locator, to consumers and caregivers to really try and better access these benefits and these supportive services. And as part of this campaign, we developed a guide to benefits for seniors, as well as a data brief. The data brief is more intended for advocates in the media, but the guide for seniors is definitely for consumers. And if you go to NCOA.org, you can find that guide to benefits. You can download it. It provides a lot of information about some of the programs that I've talked about today, as well as some additional programs on transportation and housing. And so we really encourage you to sort of circulate that amongst the people that you sort of encounter. Now, another resource that is available in some communities, not all, are benefits enrollment centers. And these were funded by NCOA to provide a sort of one-stop shopping for people with Medicare to access all of the benefits that I've talked about today. This slide is actually incorrect. We've since I made this slide, we've funded 2 more BECs, so we now have a total of 22 BECs in 19 states, which you can see on the map there. We've added another one in Illinois and in Georgia. And these are state or community agencies that do comprehensive screenings and application assistance. They also do a lot of follow-up with clients to make sure that they get the benefits. So they're not just applying, they're actually checking to make sure that they get them, that they know how to use them, that they know how to recertify for those benefits. Some of the BECs operate statewide. Some of them operate in specific kind of geographic areas or counties. But if you go onto NCOA.org, you can find information about the BECs and whether there is one in your area. Some other resources that NCOA supports. We also support these economic service centers, and these are 20 community organizations that are looking not just at benefits, but really a holistic approach to economic support for low-income seniors. So in addition to helping people do benefits applications, they're also dealing with things like foreclosures, helping people get out of credit card debt, getting temporary employment, all of those sort of activities that can really make a huge difference in the life of somebody who's struggling financially. Again, if you go onto NCOA.org, you can find the location of those sites and sort of how to connect with them if they're available in your community. Another activity that NCOA is one of the sponsors of nationally is the Senior Community Service Employment Program. This is a program for seniors who are over the age of 55 who have incomes of no more than 125% of the poverty level. And it's really intended to sort of retrain older adults and to place them in a wide variety of community service positions at nonprofits, at public facilities such as daycare centers, hospitals, libraries, government agencies, senior centers, to really sort of get them back on their feet and earning an income before it's time for them to sort of officially retire and receive Social Security. Sort of going along with some of these activities, we've developed a suite of financial education tools called the Savvy Saving Seniors Guides, and these are really tools in a box. We have a professional's toolkit as well as a consumer's guide. One of them focuses on benefits and kind of areas where people can save money by getting certain supportive services. And our most recent one is actually focused on scams and the top scams that affect older adults and how to avoid them, and if you do sort of find yourself a victim of a scam, what to do about it. And again, these are available free on NCOA's site. Anyone can sort of download them. I want to point out a few other resources that are not NCOA-based but are extremely important for this audience. If you haven't already connected with your state health insurance assistance program, I encourage you to look them up. These are federally funded to provide objective counseling to people with Medicare about health insurance and related benefits. And the SHIPs have also received money to do a lot of this benefits outreach and enrollment to help people to enroll in those benefits that help make Medicare affordable. And so they're available to, in every state, there's a toll-free number, there are local offices, there are counselors that can meet people even in public housing facilities and health centers. And they're very happy to work with this population. Very knowledgeable about all facets of Medicare and health insurance for the older adult population. You can find out more information on your specific state health insurance assistance program at Medicare.gov. And just to let you know, they're called SHIPs in some states. In other states, they have completely different acronyms. They're called HICAP in California. They're called CLAIM in Missouri. So you may not know the acronym SHIP, but that doesn't mean that they don't exist in your state. They might be known by something else. So finally, I want to just sort of touch upon a few little areas where you can get involved and you can connect the people that you see every day. We certainly encourage you to use our resources to build your own knowledge about some of the benefits. As I said before, we have webinar series, we have training modules, not only on our website, but we even have a channel of a lot of our webinars which cover a wide range of topics. I mean, everything from healthcare reform and how that affects people with Medicare to sort of this Benefits 101 to how to message about some of these programs with older adults. Really encourage you to check out those resources. As I said, our Savvy Saving Seniors guides, our Guide to Benefits for Seniors, all of those are completely free. You're welcome to download them and circulate them as much as you want. We have no problem with that. You don't have to ask our permission. We really encourage people to use those and to give them to people that you encounter. We also really strongly encourage you to forge partnerships with your local SHIP office, with your local benefits enrollment center, if there is one in your community, and with some of these other local agencies, because there's tremendous opportunity. Many of these agencies have funding to do outreach events for older adults, and they're just looking for sort of community partners. And they would be happy to sort of get referrals from you, to invite you to be at an event if you want to, or vice versa, to come to an event if you're hosting an event, health fairs, that sort of thing. They're just an excellent source of information. And also, if you encounter a patient or a client who is clearly struggling with, being able to pay their bills, it's wonderful to have these relationships in your community that you can help that person to connect with in order to sort of apply for these benefits. And then finally, I mean, if you have a public computer, we certainly encourage people to set up benefits kiosks. We know of some places that have done that, both in health centers, in public housing units. We encourage you to try and make it, semi-private, obviously, but and if you can, to have somebody, a volunteer who is familiar enough with using a computer in the program to to help somebody who may need help. But that's a very easy way to refer people to that program and to help them to use it to connect to benefits. So with that, I want to leave my contact information. You're welcome to email me with questions, and just to sort of reiterate a few of the addresses that I've talked about today. NCOA's address, where you can find all of this information, as well as the NCOA's National Center for Benefits Outreach and Enrollment, which is centerforbenefits.org, and then, of course, BenefitsCheckUp.org. Again, please use those sites. They're free. We really encourage you, and if you have any problems with any of them or if you can't find any information, please don't hesitate to let me know. So maybe I guess we can open it up for Q&A. Are there any questions?
I see one of the questions, Brandy. It's coming up.
Yes.
If someone is on Medicaid and the pharmacy mentions that the Medicare Part D card is needed instead, should the person call Medicare or Social Security Administration to find out how she was deemed eligible? Or,
right.
I'm sorry, for Part D.
Yeah, and if a person, you're right. If a person has Medicaid and then they go to the pharmacy and they're required to have their Part D card, they should call Medicare, and the phone number is 1-800-MEDICARE, and that they can request from Medicare to find out information about what Part D plan they are enrolled in. They can connect with their plan to find out, to get replacement cards if they haven't received a card yet. But definitely Medicare is the agency that they should be in contact with if they are getting a sort of comment from their pharmacist about that.
Okay. Okay, and just for those who wanted to get the webinar, today's webinar will be archived. Brandy, can you tell us a little more about Lynette, L-I-N-E-T, Lynette?
Lynette, I think that what you're talking about there, forgive me if I'm wrong, is the prescription, sort of the pharmacy prescription sort of access tool. I'm not sure if that's what the person there is referring to.
Yes, that's what they're asking about.
Yeah, okay. Because many pharmacists, not all, but many pharmacists have access to this kind of database, which allows them to search for information about the person to find out if they, for example, already receive LIS, the low-income subsidy. So usually when a person goes to a pharmacy, if they're already enrolled in the low-income subsidy, their information should be available in this sort of central database, and the pharmacist should be able to check very quickly. And likewise, if a person believes that they're enrolled in this subsidy and they're going to the pharmacist and they're being charged something much greater than the $1 to $6 range for their copayment for prescription drugs, they can ask their pharmacist to please check on their behalf in the system in order to be able to see whether they're they have been enrolled into LIS. Because usually when the person goes to the pharmacist and has the LIS low-income subsidy, the pharmacist will have that information automatically when they sort of use their Medicare card, and that way they know to charge that person only, whatever $2.20 it is for their prescription.
Okay, excellent. Okay, a follow-up to that question are co-pays $110 and $330 for full income subsidiary, or up to $6 for partial subsidy?
That's correct. For somebody who is full low-income subsidy, meaning they have an income below the poverty level and they qualify for what we call full LIS, they would pay $1.10 for generics at the pharmacy and up to $3.30 for brand name drugs at the pharmacy. For people who have slightly higher incomes, between 101 and 35% of the poverty level, they're what we call partial LIS, and they have their co-payments range from a couple of dollars up to, I think, $6.60 is the highest that they would be paying for a brand name drug.
Okay, great. And I think that has answered a couple of questions that we see.
I was just going to say, that information that person asked about the co-payments for the low-income subsidy, if you go to, NCOA has a website called My Medicare Matters. It's mymedicarematters.org. We have all of the information about those co-payments that are available on that site, so you can double-check that against the chart.
Great. And I think that's about it for some of the questions right now. If anyone still has questions, please feel free to type them in. I see that there's some other questions also, Brandy, about webinars. And as you said, everyone can visit your website at ncoa.org and be able to actually go through some of the existing webinars that you have on this topic. In addition to that, at the end of this presentation, which we are taping and we're going to archive, the presentation will be accessible as well on our website at nchph.org. So we are going to ask you to check back within the next 24 hours, and we should have the PowerPoint presentations as well as the audio version of this webinar available. And again, you will be able to download the slides so that you can use the data as well. I do not see any more questions currently in the queue. So, Brandy, if we could just hold a couple of seconds, we just check and see if there are any more questions. And as Brandy alluded to, she shared her email contact information. We really want to encourage you, if there's anything that comes up on this particular area, that you will contact her. Her email address is brandy.bauer@ncoa.org. And again, feel free to contact us at the National Center for Health and Public Housing, and we will also be able to facilitate your questions. I do want to thank you very much today for lending your expertise in this area. I think it is extremely beneficial to those of the health providers who are serving seniors, especially those in low-income housing like public housing. And I think it's helpful to know what they have available at the state and local levels. We really appreciate all the resources that you share with us, and we will also link some of those suggested sites from your site to our site as well, so that we would be able to better serve seniors who live in public housing. So thank you again for your time. I would like to thank everyone for joining us for today's topic, and I would like to let you know, to remind you that our National Center for Health and Public Housing, we're going to have our national conference May 1st through the 3rd at the Westin Hotel in Alexandria, Virginia. You will have an opportunity to hear more information on this presentation and other similar topics at our conference, and so you'll be able to ask your questions in person. So we really appreciate the National Council on Aging for rendering their expertise on these topics. In addition to that, we will have some upcoming webinars, so we ask you to please feel free to join our mailing list if you have not done at the nchph.org website. Just click Join Our Mailing List, and you will get all updates on our upcoming webinars and other areas of training and technical assistance. Again, everyone, thank you for joining us for today's topic, and we look forward to working with you in the future. Thank you, Brandy.